Hello everyone. This video I'm going to talk and demonstrate how to use an instrument called Hertel's exophthalmometer, which is used in ophthalmology to measure proptosis. So whenever in the eye clinic, when you see a patient complaining of a protrusion of eyeball, you think there is proptosis. So there are other ways to measure proptosis, like subjective ways are there, like worm's view and bird's eye view. Like the name mentions, worm's view is a worm point of view of the worm. Yeah, you look upwards, and the bird's view is like you look from the bird's eye view point of view. And when it comes to objective measurements, we have instruments, a lot of instruments like Lutz exophthalmometer. We can also use two scales, two rulers. We can also use Naugol's exophthalmometer, but the commonest one to measure proptosis is Hertel's exophthalmometer. So in our clinic, we have this Hertel's exophthalmometer. So you can see the built. There's a bar which has this calibration, which is in millimeters, and this is the base. So basically, this base is the measurement of the distance between two lateral orbital rims. And in this bar we have two prisms, this one and this one, which is above that foot plate. So the foot plate is used to keep it on the lateral orbital rim, and the prisms has its own calibrations. And interestingly, there is two rate lines which is used to avoid errors and to have accurate reading. So before you measure it, there is a patient should be seated well. Patient should be on primary gaze, and patient and the room should be well lit, and the examiner should be on the same level. The eyes should be on the same level. And after you keep this foot plate on the lateral orbital rim, you observe the red line. You align the two red lines. After aligning two red lines, the apex of the cornea, and usually I ask my assistant to have more visualization, to shine a torch. So the apex of the cornea, where it lies the measurement calibration, after aligning the two red lines, is the measurement taken. So you do the same thing for the other eye, and after that you conclude that whether there is any problem with the reading. Like if there is proptosis, usually the difference between 2 millimeters between the two eyes is taken as significant when it comes to proptosis. And also the measurements differ according to the races. And usually this instrument and to measure proptosis is used. The commonest disease is thyroid eye disease, and other diseases where there are orbital disorders, diseases caused by tumors. We have to use this instrument. So thank you for watching this, and I hope you found this video useful. Thank you.